When paediatrician Amelia Brink arrived at work at the beginning of December, she knew she had to do something. The pressure of the second wave of COVID-19 infections saw frontline soldiers buckling under the pressure in the war against an invisible enemy.
I won't lie, you don't cope all the time. It is physically and emotionally very demanding, and there are some very bad days when you deal with many deaths, and it's very tiring in PPE. These hot summer days that we've been having, even with air conditioning, you sweat. It feels like you're losing liters of water on a 12-hour shift. So healthcare workers don't always cope. But what is amazing with the initiative is that we've really had an outpouring of additional resources.
The second wave spread faster and resulted in a higher number of patients in an extremely short space of time. Brink approached 4 churches asking for aid for nurses, even if it's just a prayer. Within 2 days, she received more than 1,000 messages. The Adopt a Nurse project was born. A small group of people or a family takes care of the needs of a nurse. They will get her details, find out when she's on duty, and provide what they can.
If it's just with prayers, words of encouragement, a snack for her to have during her shift, that's great as well. It's very nice for them to come on shift and there's a little pack waiting for them with a personal note inside. It helps them to get through the day. I know there's someone out there praying for me and thinking of me.
Just under 200 nurses have been adopted so far. Brink was inundated with offers of support, and she now has a team assisting with the project.
For me, the Adopted Nurse project has been quite supportive. I no longer have to worry about what I'm going to eat when I get to work, and what my family has to eat after I've worked long hours and feeling quite tired. Thank you very much, more specifically to the people who have been sponsoring and supporting me, of the names of Lorraine, Rona, Kathy, Mari, and Connie. Thank you very much. We appreciate you, our guardian angels. Thank you.
Now after my shift, I don't have to cook at home. I just have to dish up and eat. I'm so thankful for this. May the God bless the people that have good hearts.
Brink also called on registered psychologists and trained counsellors to offer mental health support. Volunteers now also assist with stocking supply rooms and moving patients.
And a lot of the volunteers are people that are sitting at home that have lost their jobs and going into a depression. And by coming to come and give something from yourself and being busy in your day, I think it just helps everyone.
Brink had calls from across the country and even abroad. Individual members of the Strand Rotary Club and Gordons Bay Yacht Club are also on board. They provide nurses with, among others, a nutritious meal for the day at work and prepare a meal for the family at home.
The beauty is that even though we have a Rotary Club with young members that aren't really earning much, they've banded together in teams to support each nurse. And those that can't help financially are giving of time and effort. All round, it's an absolute win-win. We're able to give a hand and feel useful to the frontline staff, and the frontline staff, who are really so humble and almost a little resistant to getting any help initially, are truly appreciative and are managing to enjoy being a little spoiled.
Brink encourages anyone who wants to show their support or start a similar project with their own local hospital to send an email to Helderberg Covid Relief @gmail.com. Mariska Botha, SABC News, Somerset West.